A healthy weight is important for everybody, but especially for people with COPD. In practice, we see two problems. We see frequently underweight, and we also see overweight. Both can cause a lot of problems. For example, they have more problems with breathing, with the energy level, and also with their recovery. When we see patients with underweight, we know that the body doesn't have enough reserve to do all their normal functions. For example, fighting infections. The problem is that when you're losing too much weight, you're not only losing fat mass, but you're also losing muscle mass. And when you're losing your muscle mass, you will feel more tired, you will feel more weaker, and your mobility will be reduced. On the other hand, when there is a problem of overweight, we know that the extra weight could cause extra problems. It could cause more pressure on the body, also on the lungs. Also, obesity will give on the long term a higher risk on other health conditions. For example, diabetes, cardiovascular diseases, and also it will reduce your mobility. That is why it's important to measure your weight from time to time, because unintentional weight loss can cause problems on the long term. So discuss it with your doctor if you notice that. But it's very easy to say, just eat a little bit more. But for a COPD patient, that is very difficult because you're feeling more tired, you're feeling weaker. So the daily activities are getting harder. We see that shopping, cooking, and eating the meal is more demanding. A dietitian can help you in that situation. We can listen, we can assess your weight history, and also measure your body composition. We can easily measure the ratio between your fat mass and your muscle mass. We also will listen to your food intake, your symptoms, and then we can give you more practical advices. For example, when we see patients with underweight, we can advise you to eat more frequently during the day. It's easier and much better to eat 6 times small meals during the day than 3 big meals, because the appetite is changed. We also want to advise to use more protein-rich foods. For example, use more milk, yogurt, cheese, meat, fish, nuts, eggs. These proteins can help you to maintain the muscle mass, and if you combine proteins with physical activity, we will see that you gain your muscle mass again. Also, another important part is the energy-dense food. So if you want to use milk, just use whole milk, not skimmed milk. Also whole yogurt, for example, but more nuts. Add extra oil or butter to your meals. If that is not a solution, then we can also advise some nutritional supplements, but that is always a very individual advice that we give. Examples of nutritional supplements are the ready-to-drink high protein and high energy drinks, or you can also use the protein powders. When you're dealing with obesity, it's important to remember that your weight loss has to be slowly. If you're losing too quickly your weight, then you will lose also a lot of muscle mass. And when you're losing a lot of muscle mass, you will get weaker also on the long term. So we also want to prevent this. We advise to a moderate calorie restriction, but with also enough of proteins to remain those muscle mass. That is just the same advice as we see in underweight.